Welcome to Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management, a weekly conversation with area leaders about how to persevere during uncertain times. Now here's your host, Gary Shorman.
Hi, and welcome to Forward Ever, Leading in Challenging Times. Our guest today is Dr. Christine Fisher, who's the medical director at the First Care Clinic here in Hayes. And Chris, good to have you with us on the program today.
Oh, thanks for asking me, Gary.
You know, one of the things that this program talks about is leading in challenging times. Probably the most challenging times we as a community have been through have been the COVID crisis. I want to start out a little bit and talk about that because I see all the construction going on downtown. You've obviously made it through the COVID crisis, but tell us a little bit about COVID and where we are today versus where we were then.
Well, COVID was a big deal. Our community, thank goodness, really rose to the occasion with that. And we loved doing our vaccine walkthrough. That was very successful. So we really enjoyed that piece of it. And we stayed open during the entire pandemic with the telehealth platform. So that really worked well for our clinic and for our patients.
One of the things that I see now is you've added on and you're continuing to grow. How's that transition been?
Well, thank goodness, believe it or not, construction is on time. So despite the era, we're doing really well. And so on the corner of 13th and Main is a new express clinic and pharmacy. And we realized we love to do primary care. We love being downtown. We love the whole revitalization aspect of things. And we thought, let's expand these services even further in a downtown location. And so the Express Clinic is sort of a more evolved plan of what we've done all along. We typically had same-day appointments scheduled within our existing schedule for patients who just needed to come in for coughs and colds and flus and sprained ankles. And we realized we could even do that better if we had a specific location where we could put specific providers who do only acute care visits at on a daily basis, basically, at a time that patients choose.
When you drive through downtown, yesterday I was downtown and you see a lot of concrete trucks. I didn't see you out there pouring concrete, but when you're out there working on these projects, you see that gets done. You drive by, what will the layout be when you talk about it? Because I know where the First Care Clinic office doors are now, that's on 13th Street. What all changes in the process of this growth?
So the primary care clinics that we have remain the same at the current location on 13th Street and 22nd Street. The Express Care and Pharmacy are literally on the corner of Main Street and 13th. And so when you walk into that building, you will walk into a lobby, and that lobby is the main lobby for not only the Express Care, but also the pharmacy. And so the Express Care is scheduled to open at the very end of May. May 31st is our hopeful start date in the new clinic. And then the pharmacy should be shortly after that, hopefully later in the summer.
I had a chance to walk through the art walk was going on, and I saw you out there, and so took a quick tour. You've made a lot of progress. You've taken some relatively older buildings and turned them into something that's just going to be beautiful, exciting. That has to be exciting for you.
Oh, it does. That corner needed a facelift, to be honest with you. And so to be able to not only improve the downtown, but add patient services to that area it's part of our mission. And we want to be able to treat everybody and give them great quality care.
Talk about the pharmacy. What does that mean for the community?
Well, first of all, it's another location, which is nice. Our goal is to give great service with great prices. And so with that, we will have home delivery. And for our patients who have maybe troubles getting into a pharmacy, that will be a great service for them. And also for patients who have maybe a difficulty affording some of the more expensive medications, we can work with them as well to try to get them better prices on their medications. Tammy Zimmerman is our pharmacist. She's very experienced, great person, great to work with. And so we're very excited to have her.
Can anybody go to the pharmacy?
Yes.
So there are no requirements or anything that to be able to use the pharmacy downtown?
No, we originally set it up to service our patients, but it is an open pharmacy. So yes, anyone can use the pharmacy.
What's surprising to me is what it takes to build a pharmacy. It's not a simple project. You were explaining some of the things that take place. Explain that to some of our listeners. What has to go on behind the scenes? It's not just a room with a bunch of shelves.
Oh, no, it has to be very secured because of the controlled substances, lots of regulations, and very, very specific building codes, very specific drug dispensing rules. And so that's when we realized we needed a very experienced pharmacist to get us going with that. And that's why it's going to take a little longer for the pharmacy to finish because of the inspections, et cetera, that need to happen before you can open a pharmacy.
And then behind the pharmacy are the meeting rooms. How many meeting rooms and what takes place behind the pharmacy there?
So behind the pharmacy is actually the Express Care Clinic. We do have 4 rooms. We will initially start with one provider, but we are planning on adding a second provider for hopefully larger volumes during the daytime by the early part of fall, right at the start of cold and flu season.
Online is going to be a new way for people to connect. Now people can call in, and I don't know, maybe they can get a register online now, but I think during the Express Care, there's kind of a new process you're working on to go online. Is that correct?
There is. And so we realized one of the frustrations for acute care is the wait. And so we thought, skip the wait, book online. And so when you go on to firstcareclinic.com, you go onto the website and it says, need an appointment today? Click on that and it redirects you to the Express Care schedule. You can choose the provider and the exact time that you want to be seen.
Well, that'll speed up the process. Does it help? Will you guys have someone there to help train someone how to do that? Because,
Right.
sometimes it's not just, you work your way through that. But for older people,
Exactly
sometimes
right.
that is hard to do.
Oh, it is. We've got people with vision problems, language barriers, etc. And so we always not only have the online version, but someone is always willing to answer those questions. And you can make a call to our main number and you can schedule just literally by calling in as well. And our whole goal of that was giving good same day service, but again, getting rid of that frustration of, oh, am I number 10 in line? Or in this case, you'll be number 1 for your slot.
That sounds fun. And as people are driving by, clarify the different entries. There's one on the corner and then there's one on 13th Street. What takes place at each one, and they're really not connected? So how do you figure out where you go?
Right. And so if you are a regular established patient who has just a primary care appointment, that entrance is on 13th Street, the same entrance that has been there for many years. And in this building, we house, currently the Express Care providers are on the first floor. They will be moving at the end of May to the corner. But we also house primary care providers. And so just all of the follow-ups for diabetes and high blood pressure, et cetera, that's what we do in this clinic on the second floor. On the first floor, we have dentistry. And we'll also be getting a new dentist, Lucas Walker, later this summer as well. So we're excited to have him. And then we also have behavioral health housed at this location as well. And we have 2 behavioral health providers that see patients all day long for counseling.
You see the entries, but where do you park your car?
Yeah. Yeah. So we're just going to level some other buildings around us, and they don't know it yet, right? So
just surprise them one morning,
right,
and do that.
Right
But
away,
you have kind of done that because there is additional parking.
We did, and thank goodness, we the beauty shop had to go, I'm afraid, and so it was probably a landmark, but had to go. And so thank goodness we gained a number of slots there. We also have parking just on the west side of our building there, and so people oftentimes don't see that small parking lot as well.
And there's a drop-off point in front, so that makes it a little easier to do that as well. Chris, I want to take a quick break and come back, talk a little bit about the full mission, because I know you have another office that's now open on the East 22nd Street, and talk about that in a second. Our guest today is Dr. Christine Fisher, who's a medical director at the First Care Clinic in Hayes. Back after this.
The most successful investors are those that can keep their emotions in check and take a longer-term view at what portfolios will be worth 3 to 5 years down the road. I'd say that's the most important in determining what investor outcomes are. Market corrections will continue in the future. We've seen many of them over the years, only to see equity prices rise higher, and that'll be the case in the future.
Worth Wealth Management, enhancing lives and strengthening families.
Our guest today on Forward Ever, Leading in Challenging Times, is Dr. Christine Fisher, Medical Director at the First Care Clinic here in Hayes. And Chris, it's always wonderful to talk to you because you have a great attitude about healthcare in general. And I know you were just honored with some nice awards. I don't know if you have to be one of my favorite doctors and take care of people in my family. And so that is really cool. But when you talk about the mission, that mission kind of comes from your theory and your care of giving others, not only in the community, but being able to take care of people in our community.
Well, I realized I absolutely loved doing procedures. It pulled people out of the fire. So, it was a phenomenal first half. But in the second half, I really want to focus on full care, meaning, the behavioral health aspects of healthcare, the physical aspects of healthcare, the preventative features, roll those all into one. And we just really want to do high quality healthcare as well. And so we love the walk-in component, for example, of healthcare, avoiding emergency room visits, which are very costly. But we realized if we don't have a really good handle on, for example, the behavioral health aspects of care, getting to the underlying reasons of why people drink too much or smoke too much, if we don't have a good handle on all aspects of care, the health outcomes are not what they need to be. And so we really try to focus on all aspects of care, and then specifically the prevention, because if we treat your broken leg, but avoid looking at colon cancer prevention, mammography, cervical cancer prevention, we've done really very little in the long run to help prevent bad things that are very preventable. And so we really focus on that as well.
And you've made it easier because of the different locations you have now. What takes place? We mentioned going into the break about your location out on East 22nd Street. What takes place out there versus downtown?
And on East 22nd Street, we have 4 outstanding providers, very, very good providers. We have one gentleman who has recently joined us. So we realized that helps serve another population because a lot of the guys want a male provider. So absolutely, we wanted to fill that need. And then we have 3 other providers. And so they do primary care all day, every day. And at the 13th Street location, we of course have primary care providers. We currently are housing the express care, but we also have dental at that location. And then we have the behavioral health services at this location. We are also training one of our current behavioral health providers to become an integrative health specialist. We love to teach young people. We love to get them to where they should be in life, in a higher echelon of knowledge. So we love to have students here. We have students from Fort Hayes, from NCK Tech. We have nurse practitioner students. And we realized in Western Kansas especially, we have to grow our own to basically solidify the primary care in Western Kansas.
Who takes care of your social media? Because you guys do a great job on Facebook of telling what you do at the First Care Clinic. Is that you doing that, or do you have a team?
No, that's someone who knows way more about that than I do. And I'm grateful they do it because, I wouldn't be a person for that.
But it's really cool what they can go online. If you go on and become a friend or check on First Care Clinic, it allows you to do a lot of things, but it tells the story of what the First Care Clinic is all about.
Right. And that story is important to us. We believe in it. We believe in what we do. And we have a strong commitment to personal health, to family relationships. And that's why I just really enjoy working here. I'm very, very, very grateful to work here and to be the medical director, because the culture is one of a caring nature. And that's so important that healthcare providers can feel good about what they do, try to limit the burnout and try to help each other through difficult times, like COVID, for example.
Let's take a look, though, of people that are there. They're hearing this program, and I'd say take a look. You have hours that are really flexible and friendly for people. So they're really multiple locations. You have express care, there's a pharmacy, there's dentistry, there's behavioral health. If somebody wants to get into that system, you have plenty of ways to do that. And what's the best way to figure out the hours? I have them listed here and I can read them off, but it's going to make people dizzy. But you're open for extended hours on both, I think, 7:30 in the morning, Monday through Friday. And on many times you're open on the weekends, 8 to 5 at some of your locations.
That's exactly right. And that's by design. As part of our federally qualified health center, it is part of our mission and obligation to have extended hours. And so people who, work long, hard hours can be seen. And we want, again, multiple locations, multiple hours, multiple facets of care, so we can take care of every demographic. And yes, thank goodness we enjoy having those long hours, 7:30 a.m. to 7:30 p.m., because there should really be no instance where you cannot get primary care in Hays, Kansas.
And the other concern is cost and money. How do you work with people on that?
Right. And so we have a sliding fee scale, and it's based on income levels. And so if the income is low, we work with that, we accommodate that. And again, that's part of our mission as a federally qualified health center, is to make sure that people of any income level can be seen for a very, very low cost.
And that makes a big difference. There's no excuse not to get the best health care you can, and you have that at First Care Clinic. So, Chris, go to the Facebook site, but you can also at any time, I think, stop by and find out more, ask questions through they go to the 13th location, 13th Street location, to just ask questions and find out more.
Absolutely.
Well, I know you're around a lot. You were at the art walk the other day showing people around. So if you get a chance, be sure and check out the Facebook site. Be sure and check out the new location as you drive by. And even better yet, go visit that if you have any sort of healthcare problem, because you guys do a great job, Chris. Thank you for what you and your team do.
Oh, thank you so much. It's truly our pleasure.
Dr. Christine Fisher has been our guest here. She's a medical director at First Care Clinic here in Hays. Thanks for listening to our program. It's brought to you by Worth Wealth Management, where you can live with confidence. I'm Gary Shorman.
Thanks for joining us for Forward Ever, Leading in Challenging Times, presented by Worth Wealth Management. Join us right here next week for another episode with host Gary Shorman. Until then, remember to move forward ever, backward never.